By one of the scientists behind the development, Professor Steve Bocchini from the London School of Pharmacy. Also here is Philip Stevens, Health Programme Director for the International Policy Network. Steve Bocchini, how do you get around the problem of getting validation of this for putting it on the market? I mean, because most of the drug companies have had to go through years of testing in front of the drug authorities before they can be put on the market.
Oh, absolutely. We're university scientists. There's two things that we try to address. One of them is innovation. So the technologies that underlie the medicines that we've been talking about today are underpinned by technologies that are what we would call platform technologies.
That means already approved?
No, these are technologies that are used to make the medicines themselves. So the medicines are examples of the technology, if you. And the second point is cost containment, which is a very complex issue, which we're trying to address very early in the development stage. So we're not trying to get around patents. What we're trying to do is innovate here in the UK in ways that are addressing problems of the future.
But you're still going to have to get approval from the drug authorities,
Absolutely.
which is just as long as the companies have had to go for.
Absolutely.
So we could be years away from it yet.
Well, in some senses, yes. So what we've had
instance?
In this instance, no, not with the interferon, because in order to test our technology, working with Sunil has been important because he's a consultant in infectious disease, and the prevalence of disease around the world is not equal. And so what we've done is we've gone to the part of the world where we can test our technology in a particular medicine, while the UK universities and spin-out companies here can hold on to the technology. And this gives us a way to rapidly develop it for a very important disease that affects people in another part of the world.
Some people have been rather surprised that the pharmaceuticals haven't been angrier about this. Do you foresee anybody going to law over it?
Well, my concern is that we're all getting a little bit overexcited about a development that's taking place here, which I don't believe is really going to affect patients on the ground in poor countries all that much. Because we've seen time and time again that the price of medicines isn't really an issue. But there's over 50% of children in Africa are not getting basic vaccinations. Drugs that have been around for decades are still not getting to most of the people in need.
But it's an issue here too. I mean, people are hoping the NHS drug bill will go down.
The price of drugs is only a tiny part of delivering healthcare. That's the point I'm trying to make. In most parts of Africa, we don't have hospitals, we don't have doctors, we've got massive brain drain and migration of health workers.
Well,
all these issues, this doesn't address any of these issues.
Cost isn't a problem, really.
Well, cost is a problem. If you think about the interferon that's used in Asia right now, most of the patients that have access to it are denied that access simply because of cost. Now,
what about that?
Well, in countries like Britain, we have health insurance provided by the National Health Service. In America, you have health insurance, so we don't pay out of pocket for drugs, because drugs are expensive here as well. In countries like the Philippines, India, people mainly pay out of pocket for their healthcare. So unless you can basically give it away for free, they're not going to get the new drug. And even if you do give it away for free, the health system is in such shambolic chaos that they're very unlikely to get the drugs at any rate.
Yes, but the health systems around the world have to address the needs that they have locally. And any way we can help do that by developing medicines that people can have more access to is important. I think what the piece that you showed was very important, because the innovation that we've striven to adapt or to use in these medicines has taken many years in UK universities to achieve. And what we have to do is validate it. Now, we can go through a long process here in the UK of trying to make an entirely new medicine, or we can take this technology and try to address a need that's very specific, very defined, and acute in parts of the developing world.
Right. But you see, I mean, we do come back to this question of cost. There isn't a poor pharmaceutical multinational in the world. That seems to be no coincidence.
Well, again, on the issue of cost, this has been the way that the AIDS medicine debate has fixated on the cost of AIDS drugs. And India, for many years, pumped out generic AIDS medicines extremely cheaply and claimed to be the pharmacy of the world for AIDS patients. Unfortunately, because of the paucity of their healthcare infrastructure, only 12,000 of the 750,000 AIDS patients in India were getting.
But it's not a bad start to have some cheap drugs to start with.
Well, no,
then everybody's money can start going on the treatment.
Congratulate the professor on his efforts and good luck to him. But I don't really think it's going to create the sea change that he's claiming.
I think on this note of congratulations, before we get any further, I'll thank you very much, but it's something we'll certainly follow.